Hello and welcome back to the Advancing Health Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, man, we're super excited to have you here. Thanks for stopping by. Because you know what? We're having some really incredible conversations with just talented leaders that are really painstakingly shaping the future of healthcare. And we're really passionate around healthcare access, leadership, innovation, and adoption. And if it's your first time tuning in, let me just take a quick step back and tell you what we're trying to do here. So our focus is really bringing real stories of innovation to life. So highlighting leaders that are in the trenches, getting stuff done and making things better and giving them the platform to be able to share their stories with our community and ultimately with the world. We've just got an incredibly action-packed year of incredible content, leaders that are coming onto the show. So if you haven't had an opportunity, make sure you hit the subscribe button now, wherever you are, so that new interviews will come right to your inbox. Our field is constantly evolving, and it's mission critical to have conversations with leaders that are envisioning the future and eagerly embracing innovation to address a lot of the pressing challenges that are happening out there. And our next guest on the show is one of these leaders. I'm super pumped to have her on. So please welcome Jannine Versi, the co-founder and CEO of Elektra Health. She's really smashing taboos and leading the charge in transforming women's healthcare from menopause to Medicare for the better, with a mission to shed light on women's health issues that have long been overlooked. And having done a lot of research leading up to it, I'm really excited about unpacking that. She co-founded Elektra Health, a platform that's dedicated to bringing women's health into the 21st century. So prior to Elektra Health, Janine has made just impressive CVs, so significant contributions to healthcare and policy, ranging from roles as VP at CityBlock Health, where she was instrumental in building scalable solutions to address root causes of health for underserved populations, to impactful work with the Obama administration as a National Economic Council appointee. So Janine's accomplishments and dedicated towards improving women's healthcare are really driven by her belief that women deserve better. And she embodies the spirit of innovation, leadership, and compassion that we celebrate on the show. So Janine, it's awesome to have you come on. Welcome to the show. It's nice to see you.
Nice to see you too. Thank you so much, Michael, and for that warm and very kind introduction as well.
Yeah, of course. It's my pleasure. So let's just start with, first I want to hear about, how do you define innovation? And then I want to kind of go into your origin story. So how do you define innovation?
I think I think about innovation as a new or improved process or way of doing things. It doesn't necessarily have to be new, actually. I think some innovations are simply resurfacing better ways, more efficient ways, more effective ways of getting to the goal. And, in the spaces that we're in, those goals are typically around patient access, experience, health outcomes, any and all parts of the quadruple aim. But I think that the simplest definition is probably my favorite. Like, how do we find paths to improving the status quo?
I like that. So talking about improving status quo, so I have to be completely honest, like this was an issue that just I didn't have an awareness of. And having my mom having gone through menopause and seeing that, I'm now more aware of it. How did you and the team stumble upon this? Share with us sort of the catalyst behind co-founding Elektra Health, and what experiences or even observations drove you to focus specifically on this topic.
Yeah, sure. I think that the journey probably begins for me with my family. I grew up in South Asian family, immigrants, part of a large diaspora. Both of my parents are physicians, and I'm one of three girls. And in terms of medicine, one of my parents is a OBGYN and urogynecologist. The other is an internist, PCP. And so we just grew up at a dinner table that often was dominated by conversations in women's health. And my father's research in particular um, was in menopause, overactive bladder,
Mm.
sexual dysfunction. And so it didn't seem sort of an obvious career choice back then. And,
Yeah.
my teenage years, it was probably more cringe than anything else. But I think that something foundational happened in
Hmm.
that part of my upbringing where I think I now, subsequently realize that it was such a privilege to have an open dialogue around what is in the science, the literature, and the research that relates to women's health. And that is just so rare. And then, of course, over the course of my career, I was in tech, I was in government, and then I was focusing really on digital health and City Block, where I was on the founding team, incredible organization, really did pioneering work around the social determinants of health, but wasn't specifically focused on women's health as part of their core care model, or at least not to start. And it just struck me that there was interesting, quote unquote, innovation, new ideas and opportunities, especially around the family building journey,
Mm.
that I wanted to understand more and get to know better. And then the catalytic event was really, I was talking to people. I was having coffee chats and I was introduced through a friend and now an investor, a friend from when I lived in India doing economic development work. So, like, completely unrelated. I was introduced to Alessandra Henderson, who is my co-founder, and she had already had that idea to focus on the menopause space. And
Mm.
two of us got together, and it was like, kismet. It was many hours of conversation and kind of sucked in and got intensely obsessed in some ways with this topic, with this question. What are the gaps? What are the issues? Why don't we have better solutions for such an enormous population that is so underserved? Kind of every new stone we unturned, we were more and more convinced that this was an area that was ripe for better solutions, quote
Yeah.
unquote, innovation. And that was really kind of the catalyst for building Elektra as a business, which connects some of these earlier, more prosaic, interests more generally, some, life story and background. But that was really the impetus for building a business in the space.
Awesome. I mean, menopause has been a taboo subject and often neglected. Um, how come? How come it's been so overlooked?
Oh my goodness. I think that, like with many phenomena, menopause has been around since the beginning of time, but um, we have cultural explanations, we have economic explanations, we have medical explanations. So it's a lot to tackle. But I think if I take a stab at a summary, I think in the 21st century in the United States, menopause is a frontier in women's health where you see this collision of sexism, ageism, misinformation or disinformation, um, a lack of education on the part of so many providers. And
Mm.
that is directly tied to a large research study whose results came out in the 2000s that really discredited hormone replacement therapy, which was the mainstay of treating menopausal women. And so when HRT, which is actually now known as MHT, but colloquially HRT, hormone replacement therapy, fell out of favor to the degree that, sales fell off a cliff overnight. Women were
Mm.
flushing their tablets down the toilet because there was so much fear, imprecise and
Mm.
recklessly communicated by the media that these hormones were going to equals breast cancer, as well as potential for stroke. And the real story was much more nuanced. There were flaws in the study. Some of the findings were misinterpreted, and we could spend an entire,
Yeah.
hour, years um, talking about that. But that I think culminating with the issues we have in our society around women's health as we age and our value to society and how we think about women as reproductive beings, and we tend to privilege those parts of our lives. And you don't need to look any further than the abortion debate in America today to see how stark that contrast is when we're weighing the opportunity to welcome new life versus take care of the woman, the mother in some cases. And all of those issues, I think, intersect around menopause because it signifies the end of that fertility window. And we have become accepting of this idea that you hit a certain age, can no longer have children, and you're irrelevant. And of course, that's completely untrue.
Yeah.
But so that stigma and some of those cultural associations mixed in with those other challenges and phenomena are what make it such, I think, a potently neglected space.
So beautifully stated, by the way. And what steps is Elektra Health taking then to sort of change the conversation?
Yeah, we got going a handful of years ago when, as I was alluding to, that we were seeing some exciting companies, startups, other initiatives in the fertility and pregnancy and postpartum space, and we need all of those and more. But there did seem to be a large gap around women's health if you're thinking about what happens in your 40s and beyond. And
Hmm.
that I'm an elder millennial, like I'm heading into that phase rapidly. Uh it it was just such a taboo topic. People weren't talking about it. This concept of perimenopause, which literally translates from the Latin into around menopause, is 5 to 7 years prior to the point of menopause, which is a full year without a period. So menopause itself is one point in time. Perimenopause starts for some women 5 or 7 years earlier, for other women, even earlier than that. And then women remain in a postmenopausal phase for the rest of their lives with uh, decreased estrogen in their bodies. And estrogen is a very important
Right.
hormone, among other reproductive hormones. So it's a complex time that women are not educated about. And the first thing that we needed to do was to have this conversation. So the mission was to smash the taboo around menopause. And from the very beginning, that entailed pre COVID, that entailed getting groups of women together, bringing medical experts, so including our founding physician and
Hmm.
um, our chief medical officer, who are both experts in women's health and who have themselves trained up in the space because they needed to supplement their regular training in internal medicine, family medicine, even OBGYN, because it's a subspecialty unto itself. Um, so bringing women together with medical experts who can help to explain this is what this transition entails, this is what you can expect, this is what you can do about it. This is your array of options from lifestyle to medical interventions, the types of treatments, the risks and benefits. There's so much information and ground to cover. But starting with having that conversation and then moving into at Electra, building a platform. So the tech enabled aspect of it is what really enables scale. So much educational information that we've created and vetted and perfected, making it interesting and dynamic and bite-sized and a great fit for women who are so busy. They are the caregivers, they are working, they're taking care of the
Yeah.
family, the parents. So how do you meet their needs and meet them where they are
Yeah.
along this health journey, which starts with education and awareness and validation, and then can move into needing medical care, which we support through telemedicine. So that's the Electra platform today. It has both ends of that spectrum, from education and support to medical care.
It just shows the depth of how big this issue is in terms of who it impacts. So I read a stat and I started to kind of ponder on it. It's approximately 20% of the American workforce is currently experiencing some phase of the menopause transition. That is a massive number.
Huge. Huge. And these are individuals that are living longer. So women are outliving men. But there was a big study by McKinsey recently, um, one of these kind of shiny studies that explained the ways in which women have poorer health outcomes even as they live longer. So that is part of the goal. Like, how do we want to live our lives into our 70s, 80s, 90s, 100? Well, not in poor health with frail bones and dementia and um, without having known what we could do in our midlife era to ensure better health over that long term.
As you were mentioning something, a thought just occurred to me. It, with a lot of these, women that end up finding you through the content, through the education, through creating awareness, is there a yearning to connect and create community amongst other women facing similar issues? And how does that impact the journey? How does that impact someone being able to cope with as they're going through this type of a circumstance? Can you maybe share a little bit about that?
Yeah, absolutely. That the platform that I alluded to, I think one of the most powerful aspects of it is we equip women with education, and we do that in a few different ways. We introduce them to an expert, someone who is a healthcare professional. They may have actually been a doula, they may have been a nurse, often bring that lived experience. So that's expertise. And then
Mhm.
the final component is community, because we have learned over the years of working with thousands of women that it's incredibly important to understand what the evidence-based information is, have that be translated to you in an accessible way, and then to be able to compare it to what other women are experiencing. And that is a form of women's health that may be unique to our sex, but it is really important to be able to hear what the doctors say and the experts say, and then be able to ask one another, hey, has this been your experience? Or, what did you go through when you were navigating this time of life? And I think because this topic has been so taboo, I hear all the time that women who went through fertility issues or pregnancy challenges or postpartum might have had a bit more community or been able to connect with mothers, sisters, aunts, other women in their lives, but they
Yeah.
didn't necessarily feel that same um, openness to dialogue around perimenopause and menopause. And so the ways in which we can provide that through Elektra are really helping to overcome some of that stigma and bring a bit more humanity back into this conversation.
Yeah, it sounds like, you're using tactical empathy in a way to create a psychologically safe place where people can share and do this. Are there
Yes, yes,
other,
psychological safety is huge.
yeah, are there other things that come up that aren't necessarily in the immediate scope of Electra that allow you to think about, future products, future services that you can roll out? And to the degree that you can share, are there any things that have come up that have really surprised you?
So short answer is yes. We see the menopause transition as the starting point for the way women live and their health and well-being for the decades that follow. So this space from the, call it the 40s, 50s, 60s into the Medicare years, and we have members and patients that are on our platform or work with our clinicians across that age demographic, and their needs are slightly different. And so certainly we have lots of learnings around what the future of Electra's product can entail. I think, some of the most common areas are simply that women are in that time of life likely to experience increased risk of chronic conditions, the ones that
Mm,
afflict the average American has multiple chronic conditions by the time they reach 55. And for women, as hopefully we are talking about more and more, um, heart disease and risk of stroke are really important aspects of cardiometabolic health that we're not talking about enough. We're not um, looking for, we're not assessing, diagnosing, and treating early enough because these present differently in women relative to men. So there's a huge area of overlap there. There is certainly weight gain and weight management, which has been really interesting to see how the menopause demographic is intersecting with so many of is very similar in many ways to the same demographic that we're talking about for obesity management and
Hmm.
in the GLP-1 context. And then, when you think about the impact that declining estrogen has on every part and system of the body, from literally your skin and your hair to your bones to your heart, to the vagina to your urinary tract, like there are major implications, and those can result in gaps in care, and those can result in poor outcomes over the long term. So I was just speaking to someone recently about someone who focuses on the Medicare space, and that urinary tract infections that are untreated or undertreated can often result in admissions due to infections. And one very safe, simple, straightforward way to treat UTIs is with vaginal estrogen. It's not happening, nearly enough. It's
Hmm.
considered very safe and effective, but we still do have these opportunities. Back to our starting point around innovation, it's not necessarily a new thing, but implementing it more widely and sharing the outcomes and the research around it would be very innovative, even though the intervention itself has been around for ages. So that's an example of where I see some of these opportunities to continue to take care of women, not simply in their perimenopausal era or around their menopause specific symptoms, but in that continuum as they age into their 60s and beyond.
You've mentioned a few things, but something that's been fluttering in my mind that I don't think you necessarily mentioned it outright, but it's really around mental health. And
Mm-hmm.
um, how is Elektra addressing some of these mental health concerns, especially as they relate to, a lot of these hormonal changes?
Yeah, great question. So I think, the part of the reason we built the platform the way we did is to address the psychosocial aspects of this
Hmm.
transition. And so, we haven't talked about is when life stages coincide with something as disruptive, and not for everyone, by the way, like menopause is not terrible for everyone,
Yeah,
but
yeah.
80% of women report symptoms, and for many women, those symptoms can be extremely disruptive. Um, and some of those symptoms manifest as depression, anxiety, irregular mood or emotional lability. We hear a lot about menopausal rage. And these are the types of issues that can drive really poor outcomes for people in terms of their quality of life, and can um, make other medical conditions worse. We know about how, behavioral health impacts other comorbid conditions. So it is really important for us to think about behavioral health in this time of life. The way we address it at Elektra is we screen. So we use the clinically validated instruments to identify those who need follow up, specifically around depression, anxiety. So like a
Mm.
PHQ-2 for, those who are familiar with the parlance, or, a GAD, uh, GAD, which is going to help us understand who needs further screening, which is important for our health plan customers.
Hmm.
They often don't have that insight into their population. And we all know that investing in behavioral health yields outcomes in many ways. And so this is about getting those folks into appropriate care sometimes treating their symptoms, like insomnia, which is a very common symptom, alleviates some of those mood factors because if you're not sleeping, you do tend to start to experience anxiety, de- depressive symptoms. And so there is some interconnection there. So in treating menopause symptoms, we can often see a positive impact in mood and behavioral health. But other times we need to have a more focused approach and a psychiatric intervention, in which case we will partner with other behavioral health
Mm,
organizations. We work with a couple really great virtual solutions today. And depending on the health plans we work with, if they have a solution like a Lyra or a Spring or a different EAP, then we will surface those options to our members so that they're not having to
mm.
go scroll through their portal and find it, but we're able to close that loop, make the connection and close the loop more efficiently and effectively, as part of taking care of this person holistically.
Yeah, you took the words out, whole person care,
Yeah.
and you have this entire this community is it sounds like they have a like a loyalty, to you to go back to the watering hole to get information. Is it fair to say that they could potentially be on your platform ingrained in the community for, decades in a sense?
I mean, we haven't been around that long.
I
I would
know,
love
but
to see
potentially,
it.
right? Yeah.
But no, I mean, yeah, I think that there is a world in which we remain that home, that partner to women as they navigate these years, and these years could be, decades. I I think we're learning as we work through it with our
Yeah,
members and our patients what they need, what we're able to provide. But I think one thing that's obvious is that the traditional system is just not built to provide this kind of care typically. And one of the challenges that we encounter is, um, unlike in concierge care, we are working within the insurance-based system. So we work in network, and that also includes Medicaid and Medicare. And the payers have slightly different goals depending on which population it is and how they think about, churn, retention, continuity into a different product. And so there's just so many different factors, when it comes to, how does a digital health solution like ours kind of get paid for or reimbursed. But certainly we have members that are coming back to us after, months or a year. Maybe
yeah.
they're feeling better, they're feeling good, and then something changes. They become
Mhm.
an empty nester, and it throws their life into a bit of disarray, or a new symptom pops up, or they receive a diagnosis for breast cancer or a different cancer. But breast cancer is very common. 1 in 8 women in the US are going to be diagnosed with breast cancer in their lifetime. And that can change the game quickly. And so, who is the trusted partner that you can go to help you think holistically about your care? We're not taking over from a gynecologist or primary care doc, but we are filling in a lot of the gaps that exist because there's just not enough time and not enough
That's right.
training, for that care to be received in the existing paradigm, typically.
As I was thinking about that, I know you guys have done some research. What role does research play in Electra's sort of approach, in the future? Are there any, I guess, exciting developments within that space that you can share?
Yeah, we've been dedicated to studying what we do. So we concluded an IRB approved study. So, partnering with an academic medical center and understanding what is the experience in terms of satisfaction, knowledge acquisition, sense of empowerment, which, in that parlance is around self-efficacy. How much do you feel as an individual that you can manage and influence your own health, which is a combination of being educated first and then understanding what your options are and what you can do about it to be able to take action. And so that was, and we see really great results, in we've looked at a number of different ways. We continue to track outcomes for our members across that. We consider those kind of the psychosocial domains. And then we
Mhm.
also look at symptoms of menopause. We use a clinically validated scale. So the menopause rating scale or the menopause transition scale, to assess outcomes over time. I think the next step is really around digging into claims data, which is something that we are doing with a couple of our health plan partners. It is a time consuming process,
Can only
and
imagine.
but I think it's really important for us to be able to kind of push that next frontier around, well, what are the trends that we see? Because we have research from the last 10, 15 years around healthcare utilization, with symptomatic menopausal women. We've worked with a third party actuary to look at what are the specific ICD-10 diagnosis codes tied to menopause, and in a population that does have those codes, so we can assume that they are symptomatic menopausal women versus women who don't have those codes but are of the same demographic. So, what are the differences in their spend and their patterns of healthcare utilization? And we know that they are both more costly, in terms of their healthcare utilization, and we see associations between symptomatic menopausal women and increased areas of spend in other domains, like in the cardiometabolic space,
Mm.
in musculoskeletal. Which we know can be impacted by the menopause transition. And so I think, long answer here, but research in the space is fairly nascent. We need to do a
Mhm.
lot more of it. Some of it had been done 10, 15, 20 years ago. It needs to be refreshed. Um, Women only started, in clinical trials, being included in clinical trials in the 90s. So there
Yep.
is just so much catch up work to be done. But I think for Elektra, there's going to be some really exciting findings coming out of that health plan data around utilization, cost, trend, where people are getting their care, unnecessary spend because people are trying to get to the bottom of what's happening, but they're not satisfied by what they hear from their existing providers. We hear that all day long. So I think that will be kind of the next set of research findings on the horizon.
Well, that's exciting because maybe as we kind of wrap up here, how do folks keep track of what you and the team are doing? Give us a little bit of where can people learn more about Elektra Health and how they can kind of
Yeah.
keep tabs on you?
Elektrahealth.com. Elektra is spelled with a K. Um, we are definitely on all of the social channels. So, Instagram, LinkedIn. We are, we write a lot of content. So we've found a really excellent approach to breaking down science-based information and making it accessible and digestible to people. So we have clinicians and medical researchers who are looking at the latest studies. For example, there's just a major study that came out around in the journal Nature around estrogen in the brain and its connections to brain fog, cognition, and dementia. It is very complicated, but I
Yes.
think part of what we do really well is track those research developments and summarize them, synthesize them, and make them accessible to the lay public, so that we can all participate in at least an understanding of where the space is moving and feeling like we're not crazy and alone when the brain fog sets in, to understand that that's one of 30 symptoms that's very normal, but is also not to be overlooked. And there are things that you can do about it. So find us online. Be always happy to have conversations about this. The team and I are, you know, eat, sleep, and breathe this space. And so welcome all of the other taboo smashers and would-be advocates out there, including men and employers and providers. We all have, and policymakers, we all have a huge role to play in this.
Janine, it's been awesome getting to sort of see this from your view, from your perspective, and I enjoyed geeking out with you.
Thank you
And
for
you're
having
always
me and these
welcome to
thoughtful
come back.
questions.
Of course, of course. And for those that have tuned in, if you found this conversation to be helpful, to be enlightening, I certainly felt it was entertaining as well. Please share it, like it, comment on it. We'd love to know what you felt was useful and what you're going to apply. So Janine, looking forward to our next conversation. Thanks for coming on again.
Thank you, Michael.